Go ahead.
Section 11, Group 3, LASIK eye surgery, preoperative procedure. Patients wearing soft contact lenses are usually instructed to stop wearing them 5 to 21 days before surgery. One industry body recommends that patients wearing hard contact lenses to stop wearing them for a minimum of 6 weeks, plus another 6 weeks for every 3 years the hard contacts have been worn. Before the surgery, the patient's corneas are examined by an eye doctor to determine their thickness and with a topographer to measure their surface contour. Using low-powered lasers, a topographer creates a topographic map of the cornea. This process also detects astigmatism and other irregularities in the shape of the cornea. Using this information, the surgeon calculates the amount and the locations of the corneal tissue to be removed during the operation. The patient typically is prescribed and self-administers an antibiotic beforehand to minimize the risk of infection after the procedure.
The first step in LASIK surgery is the flap creation. A corneal suction ring is applied to the eye, holding the eye in place. This step in the procedure can sometimes cause small blood vessels to burst, resulting in the bleeding or subconjunctival hemorrhage into the white of the eye. A harmless side effect that resolves within several weeks. Increased suction typically causes a transient dimming of the vision in the treated eye. Once the eye is immobilized, the flap is created. A hinge is left at one end and the flap is open. The flap is folded back, revealing the stroma, the middle section of the cornea. This process of lifting and folding back the flap can sometimes
The second step in the operation is laser remodeling. The second step of the procedure is to use an excimer laser to remodel the corneal stroma. The laser vaporizes tissue in a finely controlled manner without damaging the adjacent stroma. No burning with heat or actual cutting is required. The laser of tissue removed are tens of micrometers thick. Deeper corneal stroma typically provides for a quick visual recovery and less pain than the earlier technique of photorefractive keratectomy. During the second step, the patient's vision will become very blurry once the flap is lifted. They will be able to see only white light surrounding the orange light of the laser, which can lead to mild disorientation. Currently manufactured excimer lasers use an eye tracking system that follows the patient's eye position up to 4,000 times per second, redirecting laser pulses for precise placement within the treatment zone. Typically, pulses are around 1 millijoule of pulse energy to 10 to 20 nanoseconds.
Patients are usually given a course of antibiotic and anti-inflammatory eye drops. These are continued in the weeks following surgery. Patients are usually told to sleep much more and are also given a pair of darkened eyeglasses to protect their eyes from the bright light, and protective goggles to prevent rubbing of the eyes when asleep and to reduce dry eye. They are also required to moisturize the eyes with tear-free and follow directions for prescription drops. Patients should be adequately informed by their surgeon of the importance of proper post-operative care to minimize the risk of complications.
Why did you decide to get LASIK?
The reason I decided to do it in the first place was because I was sick of wearing contacts and glasses. And I wore contacts during the day and I wore glasses at night. And just the cost of going to the eye doctor and buying all the solutions and replacing the contacts, and every now and then one would rip and then you'd have to buy more. It was for, to save money on that, but also just to be able to walk around without worrying about wearing contacts. Like there's so many things people take for granted, like going to the beach. When you go to the beach and you wear contacts, you constantly have sand in your eyes. And they get in your contacts, or if it's windy, kind of pushes them around a little bit. So it's just annoying. I think those two reasons were the main reasons.
When did you have your surgery? Where was it performed? And who did it?
I had mine done January 7th of 2000, and it was in Charlotte, North Carolina at the Christian Berry Eye Center. And it was Dr. Christian Berry himself who did it. Now that center, it started out just him, and now it's a huge eye center, and they have, I think, 10, maybe more doctors in there now.
What was the cost of your surgery?
I had mine done so long ago, and this was back when it was still really expensive. My surgery was $3,600, and I don't know how to do it today. I think it's still the same way, but they base it on how bad your vision is. And my vision was pretty bad, but it was still worth it to have it done. Just over the long run, it was definitely worth it. I would definitely do it again, but today it's much, much cheaper.
Can you describe the process of your surgery from when you first decided to get it until after it was performed?
Well, I decided to have it done because people I worked with were having it done, and it seemed pretty easy. So I had a consultation with the Christian Eye Center, and they did all kinds of eye exams, things that I had never seen or heard of before. They dilate your eyes, and they do a big battery of tests. And then they make you watch a video, and you actually get to see the procedure being done. And then they go over paperwork with you and cost, and then you make your decision. Because first you have to find out if you're even a candidate for it. Some people can't have it done for various reasons, stigmatism or whatever. So I was a candidate, and I knew I wanted to have it done. So my appointment was scheduled in January. I scheduled it at the beginning of January because I wanted to pay for it. I wanted to set up my flex spending account through work, and where you get reimbursed for medical expenses prior to taxes being taken out. So even though I spent $3,600, my flex account reimbursed me. I paid for it the day I had it done. My flex spending account reimbursed me as soon as I turned the paperwork in. And then I had to pay back my flex spending account for the rest of the year. But it was pre-tax. So I ended up saving, I think, maybe $700 doing it that way. So that's why I set it up in January. So I think it was maybe a month from my consultation to the day I had it done. And the day you have it done, you go in, and it's almost like follow the leader. You follow everybody else that's having it done. You go and you sit down, you sign paperwork, and then you follow the next person, and you go sit down, and you have some eye exams. And then it's time to go in, and the procedure itself was, I want to say, a minute, maybe two. The whole process leading up to it took a couple of hours, but the actual procedure itself takes just a couple of minutes. You lay down on the table, they base them over your face, they cover up one eye, they do the other eye, then they cover that one up, they do the other one, and I mean, it's bing bang boom, it is done. It happens so fast. And then they put the drops in your eyes, and they tell you to go home and take a pill and go to sleep.
What was your recovery like, and how was life after the surgery?
They give you a pill, and it knocks you out. So you sleep all day and all night. You wake up the next morning, and you have to sleep with patches on your eye. They're clear patches. This way you don't accidentally rub your eye in the middle of the night. And the next day you go in, you get looked at, and they take the patches off. And for the next week, you have to use antibiotic drops and wetting drops because you have to keep your eyes real moist. So for a week, I had to do the drops. But then next day, I had mine done on a Friday. Next Saturday, I was back to 100%. I could see, they were a little itchy, a little watery, but I could see better than I could see with my contacts or my glasses. I could see better. And I went right back to life as normal the next day. And since then, I have had an eye exam every year. Sometimes recently it's been every couple of years. My vision's been 2015. Ever since, my vision is better now than it ever was. And so luckily, all these years, I haven't had to buy contacts or TV or eye doctor appointments or glasses or anything. It's been great.